So for this question, I would like to calculate sensitivity, specificity, positive predictive value, and negative predictive value. However, there's a trick in this table, and in all my previous calculations, if you've noticed, I was placing disease on the horizontal axis. Anyone who had it would be plus, anyone who didn't have it would be negative, and then the test on the vertical axis. Anyone who had tested positive for the screening test would be plus versus negative. Here, the table is rearranged. So if you use the same arrangements that I've shown you in previous questions, then it would be confusing and you'll get the wrong numbers. So the way I do it is that I actually rearrange the table, and that would be easier to calculate. So for someone who has the disease and test positive, so patient with cancer and positive screening test, it would be the value 40 here. For someone who tests positive and does not have the disease, so test positive and does not have the disease would be 20. For someone who tests negative and does have cancer, that would be test negative and does have cancer would be 60. And then for someone who tests negative and does not have cancer, without cancer, that would be 80. So now it's placed in a correct arrangement, and now that would be so easy to calculate sensitivity, specificity, positive predictive value, and negative predictive value. And if you recall, the true values always will be placed in the numerator, which would be this box and this box. So for sensitivity, it's the first column that we are using. It equals 40 divided by 40 plus 60 is 100. For specificity, it's equal 80 divided by 80 plus 20. And then for positive predictive value, it would be 40 divided by 40 plus 20. So now we are working on rows. So it equals 40 divided by 60. And then for negative predictive value, it would be 80 divided by 80 plus 60. So it equals 80 divided by 140. And if you refer to the calculations that is shown in the text, you will see the same values shown there.